Hello, I am Paul McGee, and this is the Niagara Equissage Therapy System, which consists of a back pad, hand unit, and a leg boot. The Niagara Equissage Therapy System generates a three-dimensional vibration in a circular motion called cycloid vibration that penetrates gently and deeply throughout the horse's body. To demonstrate that cycloid vibration motion, I'm going to put the hand unit on a vial of birdseed. And as you can see, the gentle action of cycloid vibration thoroughly circulates everything in there. Another demonstration to show the action of cycloid vibration. If I put a marble on my fist, put the hand unit underneath my fist, and again that gentle action travels all the way through my fist. One more demonstration to show you how far cycloid vibration travels. If I put the marble on my fingertips and put the hand unit underneath my elbow. So if your horse has a deep-seated problem in a muscle or a joint, you can see how Niagara Equissage therapy can get to it. To show you that the same cycloid vibration comes out of the back pad as does the hand unit, I'm going to put the marble on my fist and put it on the motor on the back pad. And as you can see, that same gentle cycloid vibration comes out of the back pad also. Horses have 25 main acupuncture and nerve areas that can become blocked. And this can lead to problems with shoulders, backs, hindquarters, and the head and neck area. The hand unit is designed to give deep cycloidal massage to these nerve areas and so relieve the symptoms. The back pad will give a full body treatment, while the hand unit and the leg boot will improve local blood flow to specific injuries like ligaments and tendons, and it works great on sore feet. The back pad does the majority of the work. It kickstarts the circulation process in the horse, and by doing so, increases circulation to the majority of the horse. We are able to show this by using a thermal imaging camera to detect heat patterns in the horse's tissues. In these photos, you can see the remarkable circulation improvement following a single use of the Niagara Equissage back pad. The first image shows a horse before treatment with back pad. The second image shows the same horse 5 minutes after treatment with a back pad, and you can see the improved circulation. In the third image, 5 hours after treatment, you can see a substantial increase in circulation. Because the Niagara Equissage back pad kickstarts the circulation process in the whole horse, there continues to be a remarkable increase in circulation 5 hours after treatment is finished. If ever you have a question about using the Niagara Equissage Therapy System to treat a specific injury or to improve your horse's health and performance, please contact us by phone or email. This is the Niagara Equissage back pad. We are going to start by putting it on the horse. Just take it and slide it over your horse. Put on the girth strap and slide it down and adjust it until it's snug on the horse and won't just roll off. Then get your chest strap, put it on. The chest strap is also adjustable. It does not need to be really tight on the horse, just enough to stop it from sliding back. Then we come to the switch. When you turn it on for the first time on a horse, just turn it on one. And just give your horse time to acclimate to the therapy. If he's acclimated well to the therapy, then you can slowly turn it up to 2, 3, and then to 4. 4 is as high as you need to go. More is not better with this therapy. So again, 4 is as high as you need to go for a general treatment. The back pad has a timer. It switches itself off after 20 minutes. That's how long it takes to give it a treatment. Every time you turn the motor on, it will automatically start that 20-minute timer. On the front of the motor, beside the switch, when you turn the motor on, a green light will come on. When the treatment is finished, there will be a blinking green light which tells you that the treatment is over. If the battery gets low, the light will go to red. If the treatment is finished and the light is blinking red, it is time to change the battery. The back pad is a great tool for warming up your horse's muscles before exercise. It is also great for warming the muscles down after exercise, but use on level 2 or 3 for 30 minutes after exercise. And be sure your horse is properly cooled down before you treat after exercise. Now we're going to do the back, sacrum, and the hindquarters. When you first start on your horse on his back, you can just turn the hand unit on low. And then once he's used to it, you can turn it up to medium. Medium is really as high as you need to go. Again, more is not better. So we're going to start off and we're going to put the hand unit parallel to the horse's spine. There is a nerve channel that runs 2 to 3 inches parallel to the spine. So just put your hand unit and put the whole hand unit parallel to the spine and slowly run it back. And you can do this 3 or 4 times. And if your horse has a serious problem in an area of his back, especially in the lumbar area, I would just lay the hand unit right there and put the whole thing on his back and leave it there for 3 or 4 minutes. If your horse has a sacrum problem, we're going to put the hand unit right in here. It's almost each side of the highest point on his rump. So we just put the hand unit right there and hold it there for 3 or 4 minutes. Really helps the sacrum and the sacroiliac ligament by increasing circulation to the whole area. Another place that really helps your horse, if you put your fingers on his spine and put some downward pressure and run your fingers back, you will come to a soft spot where his spine ends. There's an acupuncture point there called the Bowie point. Just put the rubber attachment right on that soft spot and keep it there for 2 or 3 minutes. Sometimes that soft spot, that acupuncture point, can become blocked, and this just increases the blood circulation to the area and opens up that point. To treat your horse's hamstrings, you hold the hand unit perpendicular to his spine and about 2 to 3 inches from his spine, and slowly run the hand unit right back by his tail, and then come down over the hamstrings. I would do this 3 or 4 times very slowly. If you do have a horse who does have a problem with his hamstrings, I would just, after I've done that, I would take the hand unit and just hold it right there for 2 to 3 minutes. And to treat the rest of his hindquarters and go over the gluteal muscles, you just hold the hand unit right here and slowly go down over this muscle here. Again, I would do that 3 or 4 times. And again, if you do have a problem with a specific muscle or a certain area back here, after you're finished doing this, then just hold the hand unit right on that area, whether it be here or down here or down here. You can just hold the hand unit there for a couple of minutes. You can do the same on the other side. Now we're going to use the leg boot. The leg boot consists of the leg boot right here and the hand unit. The easiest way to use the leg boot is by detaching the hand unit from the belt and connecting it to a battery on the back pad. Then you just take your leg boot, put the hand unit in there, now the first time I put it on a horse's leg, the rubber attachment goes against the lower part of the knee. The body of the hand unit goes on the outside of the cannon bone. I will just turn it on low and just hold it there. Usually I'll hold it there for a couple of minutes just to be sure the horse is okay with the vibration. Then I will ease it up to medium, and if the horse is okay with it, then I just Velcro the leg boot on. If you want to treat 2 legs at once, which a lot of people do, then you use this splitter, which you connect to the battery, then connect one leg boot to this side, then you take another leg boot, which you connect to the other side of the splitter. Then you just put your leg boot on. This way it saves you a lot of time on treating legs. You can treat 2 legs at once and be done with it. The beauty about the leg boot is it treats the whole leg at the same time. You're treating all the way from here, all the way to the foot. In fact, you're treating all the way from here, all the way to the foot. It is a great treatment for soft tissue injuries like ligaments and tendons, and it's great on sore feet. Now we're going to treat a hind leg. Just take your hand unit and your leg boot and ease back here. You want to be careful. You don't want to get kicked. So put your hand unit against the outside of the cannon bone with rubber attachment against the lower part of the hock. And then just turn it on low. If your horse is okay with this, then you can ease it up to medium and just hold it on there a few minutes. If your horse is nervous about this, I would hold it on there the first day you treat him. I would get a stool to sit on and just hold it there. But if he's okay with the treatment, then you can just Velcro it on there. And again, you don't have to be attached to it because it's hooked to the battery on the back pad. If you want to treat both hind legs at the same time, you can hook the other hand unit up to the splitter and treat the other hind leg. This is a great treatment for the whole hind leg. You will feel it all the way through the leg, up and down, and all the way to the foot. So it's a really good treatment for the whole hind leg. If the muscles around the junction of the pole, atlas, and axis get tight, it can become a problem, as your horse will not be able to flex and extend his head properly. By increasing the circulation to this area, you will allow the muscles to relax, and your horse will be better balanced and be more responsive to the bridle. To treat the pole, you just turn your hand unit on low and put the rubber attachment right there on his pole. And you can leave it there for 3 or 4 minutes. And then you can do the same on the other side. And just hold it right on his pole. Then, to treat the muscles around the atlas and the axis, you can just put the whole body of the hand unit right here for 3 or 4 minutes. If your horse ever has a problem with his TMJ, which is the temporomandibular joint, which is really the joint between the upper and lower jaw, again, put the rubber attachment right here, which is right below the bony prominence up here in the skull. Be sure your hand unit is on low. Again, you can hold it there for 2 or 3 minutes. If your horse's muscles get tight in the neck area, or he has a problem with the nuchal ligament, which is a ligament that runs right along here that can get quite tight and become a problem, you just take your hand unit and slowly run it down on the crest of his neck 3 or 4 times, or hold it right here for 2 or 3 minutes. And if you're treating the body of his neck, you can just take the hand unit and run it down 3 or 4 times. Or just lay it right on there. When treating a shoulder, I like to start by putting the hand unit right in front of the shoulder blade. You'll find a soft area right there, and just hold the hand unit in there for 2 or 3 minutes. When you finish that, then you just go to your horse's chest, and it goes right in here. On this side of the center, the hand unit will fit right in there. Again, 2 or 3 minutes will do. Another place I like to do is right here in the girth area, right behind the muscle on the shoulder. If your horse is girthy or short-strided, when you first tighten up the girth, This will help to really loosen up that area and make them stride out a little better. When treating respiratory problems like mucus in the airways or lungs, the back pad should be used on level 5 or 6, as the gentle but deep cycloid vibrations will help loosen the mucus in the lungs and clear it out of there. Additional use of the hand unit will also improve the effects of the back pad. By using the hand unit on low and putting it in the brisket area, right here, and if you can keep it right here for about 2 to 3 minutes, the action of the hand unit with the action of the back pad will really help loosen up the mucus in the lungs. After you've kept it here for 2 or 3 minutes, then you can take the body of the hand unit and run it up the neck beside the windpipe, just to one side of it, and slowly run it up all the way to here. And we're going to do that 3 or 4 times. This will help open up the airway and allow the mucus to come up and out of the lungs. Really effective for getting the muscles to relax and allowing the lungs and the airway to work properly to eliminate mucus. If your horse has a soft palate problem, you can take the body of the hand unit and bring it right up here underneath the soft palate. Make sure that the body of the unit does not touch its jaw in any way. And you can hold it there for 2 to 3 minutes. Improving circulation to the soft palate will allow it to function better. When your Niagara equissage therapy system arrives, the first thing you want to do is put the box in the bag. So, the first thing you want to do is put the lid in the bottom of the bag. This will help support it. Then take the box, and the box fits down in the lid in the bag, just like that. Then you're all set. You're ready to go. When you're setting your back pad up the first time to use on a horse, you have to put your battery saddle on to get it working. Your battery saddle will look like this. It has 2 batteries on it. One battery goes each side of the motor. The easiest way to do it is to fold up your battery saddle like this, put it over the front of the motor, then slide it over the back of the motor and it will sit on the Velcro. Put your connector from your battery into the back of the motor, and you're ready to go. It's as simple as that. When this battery is fully depleted, you can just disconnect it and plug in your other battery, and you're good to go. When you are storing your back pad in the box, whether it be this box or any other box, you want to take the battery saddle off, and you always want to put the back pad on its edges like this here. You don't ever want to put it in there like this here where one side is pressing down on the other. Always put it on its edges. preferably with the motor facing up. When you are first setting up your therapy system, you're going to have to take your hand unit out and connect it to the battery on the hand unit belt, just like that. To turn on your hand unit, you just use the switch on the top of the thin end. It's got a low, medium, and high setting. Then you need to take this rubber attachment and put it on over the thin end of the hand unit and push it down very firmly so that it doesn't easily come off. Then you can store the hand unit in the hand unit belt. There is a holster, so you just put it in there, put a little strap over to keep it in there. That's the safest place to keep it when you're not using it. When you're using the hand unit, you will see a light, a small light on one side of the switch, and it will be green when the battery is good. When the battery gets low, it will turn red. If the battery gets too low, the hand unit will shut itself off. When you need to change the battery, this is the battery belt and this is the pouch that the battery goes in. Just open up the pouch, take off the top, take out the battery, disconnect it, put a new battery in here. The battery goes back in basically the same way it came out. Just take the battery, put it on its side, fit it in, put the top back on, close up your battery pouch, connect your battery to your hand unit, you're ready to go. If you don't want to use your hand unit belt, but want to use your hand unit, you can always disconnect it from the hand unit belt and connect it to the battery on the back pad. That way you can be using the back pad on a horse and you can use the hand unit from the battery on the other side of the motor without carrying the belt around. If ever it occurs that when you turn on your hand unit, the green light comes on, but you don't get any vibration, you will probably need to blow out your hand unit. So what you need to do is take out the 6 screws that you can see here on this side of the hand unit, get a Phillips head screwdriver and take them out. Then after you take them out, just the top panel will come off. Then the dome will come off. And what you need to do is you need to blow out into the top of the motor. There's a plastic piece on each side of the motor, solid plastic piece, and you need to blow out on each side of that. Or some people like to use a can of air, just like this, and just blow down in there. And while you're at it, you might as well blow out the bottom of the motor too. But the main thing is to blow out the top of the motor. Then check that your propeller isn't touching anything, and then turn on your motor, make sure it's working, and if it is, go ahead and put the pieces back on. If it's not, go ahead and blow it out again. The dome goes back in. Then turn the dome until you hear a click. It'll click in place. Then put your 6 screws back in there and you're ready to go. All the batteries that come with your Niagara equissage therapy system look like this. They are all interchangeable. They can be used on the back pad or they can be used in the hand unit. When a battery is fully depleted, it needs to be put on a charger. If a battery is fully depleted and left sitting for too long, it will ruin the battery. The batteries do not have memory, so they do not have to be fully depleted for you to charge them. When you are finished using your batteries for the day, put them on a charger. Now we come to the battery chargers. These are the battery chargers that come with your therapy system. When you plug a charger into the wall, a green light will come on the upper left-hand side, which means you have power to that charger. When you plug a battery into that charger, a yellow light will come on the bottom right-hand corner. That means that your battery is charging. If that yellow light becomes a flashing yellow light, it means that the charger is checking the charge in your battery. But it will go back to a constant yellow light again to charge it. When your battery is fully charged, you will have 2 green lights. You will have a green light on the left, on the upper left, and you will have a green light on the upper right-hand corner, which means your battery is fully charged. If you leave your battery on the charger after it's fully charged, the green light on the upper right-hand corner will flash green, which means your charger is checking your battery to see if it needs to be charged again. So a green light or a flashing green light means your battery is good to go.
My name is Michael Matz, and I've first started my career in the show jumping world. I've had some very nice horses. Went to 3 Olympic Games and 4 Pan American Games and a couple of World Championships. After my career in show jumping was finished, I went to the race horses, and I was lucky enough to train some really nice horses like Barbaro and Union Rags, and the Niagara equissage system has been there all the way. We got our first Niagara equissage system about 6 years ago, and about a year later we needed another one because the use it got was just too much for one machine. So we have 2 of them right now, and we have 50 to 60 horses, and we use this from the time they go out in the morning till after works and before works. And one of the best things about the Niagara equine system is that we can use it for horses that are stall bound or to the horses that are, our top athletes, and I find it really helpful before a horse goes out just to loosen their muscles up, especially on fillies that will get tight on us after work. From stall bound horses to top performers in every discipline, the Niagara equissage system is beneficial in every way.